Our first presenter for today, Jessica Nwatu. Jessica Nwatu is a licensed dental therapist who is currently working at Dent Clinic, Victoria Island, Lagos. She'll be presenting on the topic childhood vaccination in the prevention of diseases. Jessica Nwatu, the floor is open. You're welcome. Is Nwatu Jessica with us?
Good morning, everyone. Sorry, I was previously muted. Thank you all. Good morning. Thank you all for joining. This is the 10th ORAPOSIUM, and I'll be presenting the topic childhood vaccination in the prevention of diseases. I have the following contents: introduction, how do vaccines work, benefits of childhood vaccination, diseases that vaccines prevent, side effects of childhood vaccination, conclusion, and references. By way of introduction, vaccination is one of the most cost-effective measures available in public health today. The reason why it's cost-effective is because it prevents the occurrence of diseases before the disease happens, before the disease begins. So instead of waiting for a disease condition to manifest, the role of vaccination is to ensure that that disease doesn't happen. So cost in treatment of diseases is minimized or completely taken out of the equation. There's a difference between vaccination and immunization. Most people interchange the two to mean the same things, but there's an actual difference between the two. Vaccination is the administration of the vaccine, while immunization is the process by which the body now becomes immune to that disease the vaccine is supposed to prevent. It means that when a child is taken to a public health center and is vaccinated, that part is called vaccination. But the process whereby his or her immune system begins to work regarding the vaccine he or she just took, that process is now what we call immunization. So as a form of proper definition, vaccination is the administration of agent-specific but relatively harmless antigenic components that can induce protective immunity against the corresponding infectious agents in vaccinated individuals. Immunization, on the other hand, is the process whereby the person is now made immune or resistant to that infectious disease. So vaccination is the act that initiates immunization. They are not the same thing, although they can be used interchangeably sometimes. So vaccines have been proven to be effective because they do not pose risk to the child's life or to the adult's life, as the case may be. The only thing they do is tricks of a sort, trick the immune system to believe that it is being attacked. It doesn't actually create or cause infections. It doesn't exactly cause infection in the patient, or it causes, if at all it causes really mild treatable infection. So it tricks the immune system to believe that I am being attacked attacked by measles. So it is effective in preventing serious diseases. Vaccines can be made from a variety of parts of the microorganisms. It can either be made from the dead form, the killed form of the microorganism, as in measles, or then it can be made from the attenuated form, the weakened. It's still alive, but it's weakened. The ability for that organism to cause disease is reduced. That's what attenuated means. Or it could be from its toxins or the toxoids or proteins of that microorganism. So those are the three forms where a vaccine can be made from an organism. In every individual, we have active and passive immunity. When a child is in the mother's womb, every antibody, the mother. Hello? Hello?
We can hear you. Go ahead.
Hello?
Hello, Miss Jessica. Go ahead.
Okay,
We
I'm
can
so
hear
sorry.
you.
I was logged out. I'm so sorry. Um, in a child, in every individual, there's active and passive immunity. So when a child is in his or her mother's womb, every antibody the mother has, or most antibodies the mother has, is passed from the mother to the child. And when he or she has been brought to the world through breastfeeding, antibodies are also passed from the mother to the child. Or in the hospital where there is exchange of blood or transfusion of blood. These three forms are ways of acquiring passive immunity. They do not last. The maximum they last is for a couple of months, and it is not sufficient to effectively protect a child from infectious agents that is literally all around us. So the purpose of vaccination is to create active immunity. There are two ways whereby an active immunity can be gotten in a child or in an individual: from vaccination and then from the disease itself. The first form of active immunity is when I get the disease, or the individual gets the disease and recovers from it. When it happens again, the body already knows what to do regarding that disease. That is a form of acquiring active immunity. While vaccination too is also a form, a live or attenuated, or the proteins of an infectious agent is injected, and then the body fights it and attacks it like it is the actual thing. So it allows that when the actual virus or bacteria, as the case may be, invades the person's body, he or she is able to fight it off. So how do vaccines work? Vaccines work by three major ways, basically. They work by recognizing the invading microorganism. When a vaccine is injected into an individual, our bodies, our immune system recognize that this thing entering is not part of us. So it recognizes that this is not something that we want, or that we are used to, or that is good for us. So as a form of response, our immune system, white blood cells and the rest, produce antibodies to these antigens that were introduced. So it produces antibodies to fight those diseases, or that vaccine that was injected, thinking or agreeing that this thing is not what we want, it's not part of us. So after it fights it and effectively conquers it, our body now remembers, stores that information, so that next time when something like that comes, they know how to fight it. So when a vaccine is introduced, because of the mechanism of how it works, a person can be protected for a longer period of time. He or she has been able to fight off that infection, even if it wasn't an actual infection, it was just a vaccine. The body has been able to fight it off and then remembers or stores it in memory, so that when the actual thing comes around, our bodies are able to fight it off. So, reasons and benefits of childhood vaccination. Childhood vaccination activates the immune system, as I said before. It wakes our immune system up that this is something we don't want. So it activates it, helps fight off infection without putting the body at risk. It doesn't put the body at risk because of all the reasons I've mentioned before. The vaccine is made from an attenuated form or a killed form or the protein. So it doesn't have as much power, basically, to cause serious damage. There are actually some people who cannot receive in vaccines. Those people, because if they receive it, it's possible it would overwhelm their immune system. All those are people with HIV, cancer, or have reactions to the components of the vaccines. Those group of people are not allowed per se to receive vaccinations. But every other individual, when a vaccine is injected, it helps activate the immune system to fight off that infection that is represented in the vaccine. Then secondly, it saves money in cost and time that would have been used in the treatment of disease. If vaccination had not been introduced in the first place and we had waited for measles to happen, for instance, it would result in spending so much money in taking care of the child, in panicking, in rushing the child to the hospital, in buying drugs, sometimes paying for hospital bills. And if it's the severe form of measles, it will lead to blindness and a variety of other side effects. So it saves so much money and time that would have been used in treatment of that disease. Vaccination saves life from vaccine preventable diseases. If a vaccine is injected, that's infection it was made to protect against is removed from the child's worry per se. It would continually save that child from adverse effects or reactions from that disease that from the disease he has been vaccinated from. It protects future generations. Today, smallpox has been eradicated. In the 20th century, it killed billions of people. But because of the advent of vaccines and vaccination, we today are living because it was eradicated. If it wasn't, maybe it would have caused more deaths for this future generation. Polio also is almost 99% getting eradicated from the world. So that way, in a couple of years, our children would have no idea that there was a disease called polio. So it helps protect future generations. Then number 4, it brings children in contact with healthcare at an early age. I would use an example in dentistry. When children are introduced to the clinic, so our dental clinic at an early age, as they grow to become adults, they are very comfortable per se when they come around for dental appointments. But a child who comes to the dental clinic for the very first time at age 15 has this fear and phobia and anxiety relating to dental treatments. But all those ones who have been coming since maybe 5 years are so used to the environment. It is not a problem per se for them. So it helps, and vaccination therefore brings children in contact with healthcare at an early age. From the month of from 2 months, from 3 months, a child is taken to the primary health center or the maternity home or the hospital or clinic, as the case may be, and is introduced to the healthcare sector. Number 6, reduces the burden of diseases on individuals, communities, and nations. If there were no vaccinations, the rates of diseases and infections in our communities would be too high. Our healthcare sector would fall. Our Ministry of Health would be at the verge of crumbling. The burden, the time, the money that would be spent or pumped into our healthcare system is going to be too much. So because of vaccination, it has reduced the burden of diseases that communities face and nations face. It helps reduce transmission of disease. If I am, this one is in accordance with number 8, allows for the possibility of herd immunity. Herd immunity is the phenomenon in which if there are 20 people in a community and 10 people, half of that population is vaccinated. When measles, for instance, comes into that community, because it moves around by human contact, as the case may be, when it gets to person A and the person is vaccinated, and because he is vaccinated, person A cannot transfer that infection to person B. So the transfer or spread of disease is very limited. So if a child is surrounded by, if one unimmunized child is in the midst of 3 immunized children, he or she would not fall ill, basically, because everybody around that child is protected against those diseases or that particular disease. That's why sometimes in households, when the mom has been vaccinated for hepatitis B, for instance, the father has been, the brothers, the sisters, and a new child is born, because of his or her presence in that household for a certain period of time, the immunities of the parents and siblings somehow covers that child, pending when he or she now gets vaccinated for himself. So that's the whole concept of herd immunity. Helps reduce the length of illness and hospitalization. As I said, if they had waited for the child to get ill, they'll spend more money in the hospital, more time, more reasons to panic, and all the rest. So diseases that vaccines prevent. We have a variety of diseases, so many around the world. We have the first one is diphtheria. It is produced by a toxin that destroys body tissues and organs. It spreads through physical contact and respiratory droplets. Its signs show as sore throats, as fever, as loss of appetite, as swollen neck. Sometimes his or her neck, the child that is infected by it, is swollen and the airway is obstructed. It is an acute bacteria of the tonsils, the pharynx, the larynx, and the nose. It occasionally affects the conjunctiva of the eye and can damage the heart. As well, this disease is transmitted by droplets, secretions from the nose, secretions from the throat and eyes, contact with skin ulcers, from clothing that have been shed or contaminated with people who have the infection. It spreads like that. So in a community that has overcrowding or poor living conditions, or where children have not been immunized effectively, or where there is malnutrition, it's easy for this disease to spread among those group of people. The vaccine that is used for this disease is DTP. It is a combination of tetanus and other disease vaccines in one. It is a 3-in-1 vaccine. The reason why people or the World Health Organization produce vaccines into, like, maybe for a particular bottle, there's a mixture of 3 vaccines that can be used to prevent against 3 different infections, is to reduce the amount of times a child moves to and fro to the hospital. Because if you have to be vaccinated against measles at 6 months and against cough at 7 months, if the child goes the 6th month and then goes the 7th month, it's a burden basically for the parents and the child. But if it is combined, it reduces the amount of times a child sees the hospital. Then for tuberculosis is a very, very serious infection. It attacks the lungs, and our lungs are responsible for respiration, for breathing, for circulating air around the body. The infection of tuberculosis can actually last a lifetime. Some people have tuberculosis, have TB, but they are not showing symptoms of that disease. So because they do not show symptoms, they are carriers. They cannot spread that infection to others because it is spread through coughing and sneezing. And if I am not coughing and sneezing, I cannot give it to somebody else. So for TB, for tuberculosis, most people have it for a lifetime, but because they are properly vaccinated and do not show signs of infection, they are not able to spread to other people. The signs of the disease include weakness, weight loss, fever, night sweats, severe bloody cough, chest pain. In children, the major signs of tuberculosis is stunted growth and failure to thrive. You see that you're feeding a child, you're giving the child everything a child needs, but he or she is not growing per se as the rest of his mates are growing. So it's a sign of tuberculosis in children. For measles is a viral infection. It's highly infectious. It occurs as an epidemic. It happens and it spreads through countries at a particular period in time, and then it goes. But it's mostly around low-income communities or low-income countries. The spread is through nose and throat secretions of infected people. High fever occurs as a sign. Once a child has been exposed to the measles infection or the measles virus, it takes like 10 to 12 days for the child to start showing symptoms. So within that 12 to 10 days, he or she is also affecting other children. That's why in a class of children, in a pre-nursery class, if one child has measles, in a few days, the whole children in the class, the rest of the children in the class have measles too. The good thing is, if a child is vaccinated among that group, even if he or she gets infected by that measles vaccine and begins to show symptoms, after a few days, it heals itself basically, because he or she has been introduced to the vaccine before. So the immune system is already aware of what needs to take place for this thing we don't like to go away or be taken care of. The major causes of the spread of measles is when children gather and in schools or health centers. Signs may include other signs apart from high fever, may include running nose, spots, rashes, cough. It may even cause pneumonia, diarrhea, malnutrition, just general irritation in the child. The vaccine is MCV, measles containing vaccine. For pertussis is whooping cough. That's the local name or the general known name for pertussis. It's a disease of the respiratory tract. It lives in the mouth, nose, and throat. It's spread by droplets in coughing and sneezing. The symptoms include common cold. When it is not treated, it can result to pneumonia, to seizures, to fever, and to convulsions. It is an infection that affects a whole variety of the body and different organs of the body. Then the next one, is hepatitis B. It's caused by a virus. It infects the liver, spreads through contact with blood from the mother to the child, from social interactions, from sexual intercourse, from unsafe injections. The signs include fatigue, nausea, vomiting, jaundice, cirrhosis of the liver, cancer, and a whole range of signs and symptoms. For polio is highly infectious among children. It affects children less than the age of 5. It causes paralysis when the virus affects or attacks the nerve cells of the spinal cord. It spreads from poor sanitation areas where there's infected food as a result of fecal contamination. There is no cure for polio, so the only thing that exists for the disease is management. There's treatment for orthopedic care, for physiotherapy, for ventilators if they have issues with their breathing. So tetanus is present in soil everywhere. The virus, the bacteria causing tetanus is present in soil everywhere. So when the infection occurs when soil enters a wound or a cut of a child, it causes severe pain, muscle spasms that can eventually lead to death. The ways it is transferred is through dirty nails, knives, tools, wood splinters, dirty tools used in childbirth and circumcision. The first sign is usually lockjaw, trismus. So the other diseases are rubella, typhoid, the yellow fever, rotavirus, mumps, cholera, and so many more. Side effects of vaccination. Immunization is the cornerstone of the community's efforts to protect people from infectious diseases. Although vaccines are not without side effects, most of these side effects are mild because according to the Food and Drug Administration, they ensure that vaccines are effectively tested before sent out. So if there are 1,000 bottles of measles vaccine and they are given to 1,000 children, less than 1% will react to the vaccine because it has been effectively tested. But in cases where side effects can occur, it ranges from rashes at the site of the injection, swelling, pain, malaise, loss of appetite, fever, which reduce or recede after a few days with adequate care. You treat the rash or the fever or the pain for a period, like when most of us took our COVID vaccine, we experienced pain at the area where the injection was taken. Some of us experienced fever. With paracetamol, it was relieved. The swelling with cold compress, it was relieved. So the individuals who have adverse effects to vaccination are those people who maybe are immunocompromised, like HIV patients or cancer patients, or people who have allergic reactions to the components of the vaccine itself. So it's not the vaccine causing the problem sometimes. It's the ingredients or the materials used, maybe the preservative or the agents of mixing that was used. So when side effects occur after vaccination, it lasts for a couple of days. It doesn't exceed a few days when it is adequately taken care of. People who shouldn't even take vaccines at all are the people I've listed already. People with HIV or cancer or have immunocompromising conditions. In conclusion, the phrase prevention is better than cure is the ballpoint of immunization. It ensures that avoidable diseases and deaths are prevented, thus allowing individuals to live healthy, protective life. As personal as vaccination sounds, we should understand that it is a general thing, like as the case with herd immunity. Because this child is protected, many other children can be protected. Some people believe that naturally acquired immunity, that's from having the disease itself, is better than immunity provided by vaccines. But the if we wait for a child to come down with the infection, it can cause deadly complications that would lead to more serious conditions. But and it is impossible to predict how a child will react to getting infected by a disease. So it's better to use vaccines. You already know the range of side effects that can be gotten from vaccination. This way, a child is prevented when the actual problem now comes. It is not a personal mission, it is a general thing. When our communities take vaccination or immunization, as the case may be, seriously, it brings us closer to the World Health Organization Health for All mandate. These are my references. Thank you.